and welcome to Health Curious, Episode 5. Today, I'm speaking with Mr. J. He is from the Connecticut metropolitan area. Tell me a little bit about yourself and your upbringing.
I'm Jay Miola. I'm 48 years old. Was brought up in a home of five, and I was a pretty typical, let's say, middle-class upbringing.
What has your experience been like dealing with doctor's appointments, hospital trips, healthcare-related issues, etc.?
As somebody who's lived with a chronic condition for my entire, basically, adult life, starting at 14 years old, it's definitely been a very prominent component of my upbringing and my life. It's health insurance and access to quality healthcare has been a very important component for me to stay healthy and to maintain a regular lifestyle, for sure.
What medical experience, good or bad, has impacted you the most?
Thankfully, I've never broken an arm or a limb or anything like that. So my experiences with the medical industry have been haven't been catastrophic, I'll say. So that's been helpful. However, when you do live with a pre-existing condition, things like health insurance and healthcare are extremely important, especially when, it becomes important for kids as young as 14 years old to understand legislation as it relates to pre-existing conditions and continued healthcare, as a result of something you have no control over, something that requires regular maintenance in order to maintain quality health.
Got it. So I guess stemming off of that, how has this experience impacted you in the long term?
It certainly made me very aware, whereas sometimes people in their early 20s are not terribly interested in maintaining health insurance because they do, tend to be healthier individuals in general. It's something that's, been very important for me to maintain good health insurance, to maintain, a quality care program, because it obviously has a financial impact too when you need to go have regular doctor's visits annually, over the course of the year. So it's certainly been, impactful for me in terms of, planning finances, sometimes planning vacations. Certain treatments are required on specific timelines, and they can't really move. So that's been something that's difficult to maintain, but something you just become used to over time.
Does your primary doctor help you with this, or is this something you've had to manage on your own pretty much?
There's usually a specialty doctor involved, and then that person sort of gets you on a plan. In terms of how well that plan works. Sometimes the medications wear off over the years, and you need to switch. So you have one constant, as a specialist, and then there's a primary care doctor that deals with, anything that's your standard annual visits to, just a common cold and requiring some level of medication.
Got it. So this chronic illness, I'm assuming it factors into how you choose your doctor, correct?
Yes, absolutely. When you're looking at specialists, you're hoping to find the best one that your plan will cover, so you don't have to necessarily go out of pocket for it. But thankfully, within the vertical that I deal with, there are many great care physicians that are specialists that are both in the area and then also within striking distance, New York City specifically, so you can get world-class care as a result of our proximity to that location, for sure.
Mm-hmm. Based off of your experiences with dealing with insurance, for example, or anything else that you've found to be that you've struggled with within the healthcare realm, what areas of growth do you think should be implemented to maybe alleviate some of these issues?
Well, the one of the most impactful and interesting things that I learned over the years was that This was told to me by a doctor, but it's not backed up by any level of you know journalistic backing. So, but it seems to check out, which is um, a standard health insurance company will want to try and make it a little bit more difficult for you to get reimbursements for necessary treatments, especially when it's things like pre-existing conditions or even mental health invoices. So they're a little less likely to want to try and help you, at least out of the gate. So I was once told that there's a little bit of a game that health insurance companies play, which is if they can get people to try and call 3 times, they know there will be drop off each one of those times, and then people will stop calling, stop trying to get the invoices covered through health insurance and just pay them out of pocket. Um, Again, this is unsubstantiated, but it seems to check out based on my experience that submissions will get kicked back for any for any reason, whether it's a code or an incorrect address or something to kick it down to a second, third phone call, and then after 3 phone calls, typically it'll be reconciled. But as somebody who deals a lot with getting reimbursements, getting out of network doctors paid for, sometimes it's certainly something that I've had to do over the years, which is to spend a lot of time on the phone with health insurance companies trying to reconcile some of these older bills, trying to get them covered. When coverage should be extended for the sorts of things that I personally have been doing or people in my family have needed access for. So that's certainly been an impact on me in terms of time and time on the phone with insurance companies. And certainly when you look at a for-profit business, which are making sometimes, around 50% margins on insurance, something that's supposed to cover you in times of need or times of disaster, it certainly, it sort of checks out.
Yeah. The 3 phone calls you were referencing, it sounds to me like it's just like it feels like a lot of time and resources put into dealing with the insurance companies when really you're not getting a whole lot of turnout, when it's just almost like a frustrating process of just like trying to pay bills or keep up with the insurance. It's just
Yes, no, absolutely. I mean, the getting reimbursed and the finances of insurance are, the sort of most difficult part. Typically, finding a doctor, finding a quality, physician is never really the issue. It's more about, are they in network? Are they, covered? If they're not in network, or they're a specialty doctor that you want to go visit, what percentage gets covered by health insurance? So it's certainly a roadblock in some cases when you're talking about the finances of insurance and healthcare. And over the years, that's certainly been one of the biggest things to have to deal with when you're dealing with an ongoing chronic condition.
if you could implement something to maybe fix this process, would it be?
I think greater transparency, and a more strict set of guidelines around, the process by which this happens, so that people can know for certain that if they submit, bills that should be covered by insurance companies, that they will in fact go through and they will in fact get reimbursed within, a reasonable timeline. Certainly, this is a backup at doctors' offices as well. They have to carry a lot of staff in order to work with the insurance companies to get their reimbursements on their side too. It's not just the patient side as well. So, certainly, some level of a, I mean, I hesitate to say automated, but automated would be wonderful. It's automated to a certain degree now, but it's not, it's not consistent, and it seems like the rules change, from situation to situation. So I think greater transparency would be a start. And then certainly moving north of that, things like, automation would be great. Automatically, not, you not having to submit, a second invoice or upload documentation, things in that, to that nature that could make make it a little bit easier for, for fulfilling these invoices, outstanding balances.
Yeah, especially I think because if you're doing the 3 calls constantly over months and years, it feels like they should have it be automated, but I guess for the most part it isn't. So that's definitely frustrating.
Yeah, well, there are some things that are that I can't sit here and say that there are instances where things don't just go through. There are certainly those, but it seems like on the larger ticket items, the bigger invoices, those are the ones that end up getting stuck in the system for a bit. Take a little bit more of effort to for those to get reconciled.
What advice would you give to others who maybe have a chronic illness as you have, just in terms of dealing with the healthcare system and how you've managed thus far, considering you've had this illness since you were 14 and you were kind of thrown into deep waters? I guess just share some insight on how you've been able to manage that.
Well, certainly maintaining consistent health insurance, not dropping insurance for financial reasons is super important. As political leadership changes, sometimes these laws can also shift. So it's important to maintain health insurance, even when you're in your early 20s and you're thinking, I'm fine and don't really need it. It's it's great to maintain that. Certainly being well organized when it comes to being able to submit any of these these balances, invoices, and things like that. Staying organized, having your digital life organized around it is super, super important to just make sure that you can track all these things. And a lot of the healthcare websites are pretty decent about it, but making sure that you have a backup is super, super important. And then as you change health insurance, making sure that as you switch, that your primary physicians or any specialty physicians are, all capable of staying on your program so that you don't have to have inconsistency in treatment, is usually a big thing too. So, wanting to make sure that, plan coverage, like for instance, if you were to change jobs, they typically offer you a variety of different options in terms of health insurance, and making sure that, your team of doctors, especially if you're somebody who lives with a condition that requires regular maintenance, your team of doctors are still covered. So you have that continuity, super important as well.
That right there was my interview with Mr. J. I thought that his insight on his own chronic illness and how he has managed that since a very young age is truly important to understanding just how much having good health care can affect different people. I also believe that his thoughts on insurance companies and the struggles that come when dealing with health insurance was very relatable and very important. Thank you so much for taking the time to be interviewed, Mr. J. Thank you for listening to Health Curious. If you'd like to subscribe, you can do so on Spotify or YouTube. I hope you'll join me again soon.